Hello, everyone. As some of you may know, kidney disease is often silent until it's too late. We asked ourselves, what if we could make it visible earlier? Introducing NephroRx, a 3D volumetric kidney analysis software with patient-specific treatment insights. Before we talk about what NephroRx does, I briefly wanted to speak about how this idea came to us. HackRx2025's theme this year was about innovating lifelong care. We were challenged to design and develop solutions that empower pharmacists to support chronic disease prevention and management across the lifespan, improving access, personalization, and continuity of care. Let's dive into why we decided to specialize our focus on kidneys. According to a major 2025 study from NYU Langone and IHME, CKD affects nearly 800 million people worldwide, and most cases are detected too late. Despite this, dosing, monitoring, and treatment still rely on parameters such as weight, serum creatinine, and 2D slices, not the patient's actual kidney anatomy. With this, we saw a huge opportunity to use 3D imaging to study the inside of a kidney. This is why we built NephroRx, to make kidney care precise, anticipatory, and anatomy-driven. Let's move on and talk about what NephroRx actually does. In short, NephroRx is an all-in-one kidney analysis tool, converting CT or MRI scans into 3D models, measuring structure and volume, detecting abnormalities, and generating anatomy-based drug dosing insights. Before we hop into the demo, I wanted to briefly touch on NephroRx's workflow. We start by uploading a CT or MRI scan. From there, our system constructs the kidneys into a full 3D model and performs automated segmentation. Once we have the mesh, we calculate total kidney volume using vector-based geometry, and then run structural analysis. This helps identify things like roughness, CVI, and kidney symmetry. We also screen for abnormalities, including cysts, tumors, hydronephrosis, and signs of atrophy. This information can present a whole number of different clinical insights, which we'll show you live in just a second. Now, let's hop into our demo.
Welcome to our prototype of NephroRx. We dropped a link in the chat if anyone wants to give it a try. NephroRx performs advanced kidney analysis directly from medical imaging using computational geometry. If you scroll down, you'll see we collect essential patient information such as age, sex, weight, and serum creatinine. These are all used to analyze kidney structure and detect early abnormalities. Currently, we support CT and MRI scans in both NIFTI and DICOM formats. Once the scan is uploaded, we construct the kidneys in 3D, calculate kidney volume, and display the KRI.
Now, let's move on to drug dosages. Take the example of cyclophosphamide, a chemotherapy drug where dosage heavily depends on patient weight. This becomes a problem for obese patients or patients with amputations because weight-based formulas become inaccurate. To minimize this, we decided to use the patient's expected total kidney volume to calculate a kidney ratio. Now, for full disclosure, there was a small calculation error because expected TKV was for one kidney, but our calculated TKV was for both. So the kidney ratio is off by a factor of 2, and therefore the dosages are also off by a factor of 2. Overall, however, this TKV ratio allows us to calculate a more accurate dosage for those drugs who normally rely heavily on patient weight.
Next, let's go into the analysis section. We start with surface roughness, a metric that captures bumps and irregularities across the kidney surface. Research shows that a high roughness can signal early cyst formations or tumor growth long before they appear clearly in raw imaging. Then we calculate the Curvature Variability Index, or short form CVI. This measures how much the kidney surface deviates from a smooth surface. A higher CVI values are associated with polycystic kidney disease, hydronephrosis, and other shape-distorting conditions. Both of these metrics help estimate a patient's risk of developing CKD. Now let's move on to the biological medication. Biological therapies like ESAs and immunosuppressants are extremely costly, and timing their use is critical. Using structural metrics like the Kidney Filtration Index, we can guide pharmacies to identify when a patient's kidney function is trending towards the point where these medications can be beneficial. By tying KFI trends to kidney changes, clinics can identify the patients that will be benefited from these therapies and avoid unnecessary prescriptions. This lets pharmacists and clinicians target the right patients, avoid high-cost prescriptions, and monitor how well a patient responds to therapy over time.
Lastly, we like to go over the tech stack. We built our prototype using a combination of advanced 3D imaging algorithms and modern web technologies. On the back end, we constructed the kidneys from scanned data using marching cubes, then applied calculus such as the divergence theorem to compute the CVI and surface roughness. Our front end is built using React, and for visualization, we integrated 3.js to create an interactive 3D environment where doctors can explore the kidney model.
Our mission is clear. We hope to help empower clinicians in preventing and managing chronic diseases through real anatomy. Thank you for listening, and we hope that you enjoyed our presentation.